Good afternoon. My name is Jim Dice. I'm one of the registered nurses here at Twin Oaks Home Care. This is DVD number 6 in orientation. We are on page 11 of the employee handbook, and we are on number 24, care of the client in bed. Patients are not always able to get up and get around in their homes. There are times when we will care for individuals that are bedfast. We have to also make sure that it's safe. We will give them a bath while they are in bed. We will turn them and reposition them. Every 2 hours is our policy, 2, 4, 6, 8, 10, 12, etc., AM and PM. We need to make sure that the side rails are up, especially on the side that you're not standing on. If you're going to go to the other opposite side of the bed, you're going to put the rail up where you're standing before you proceed to the other side of the bed. Once you get to the other side of the bed, you can put that rail down. We also want to be very careful whenever patients are eating or drinking anything in bed. They can aspirate, which means the food or liquid will go down into the lung instead of into their stomach. To make sure that doesn't happen, the head of the bed must be elevated at a 45-degree angle. This is flat, and this is 90 degrees. Half of that would be 45. That's how high the bed must be elevated for us to be able to give someone something to drink or eat. Also, you want to make sure that there's appropriate lighting. You want to make sure that they're stimulated, that they're aroused. You don't want them to be half asleep and you trying to give them something in their mouth. They will choke on it that way if they're not aroused enough as well. Sometimes we have to wait a little bit, 30 minutes, 60 minutes before giving them something to drink or eat once they're alert enough. Number 25, rehabilitation. Rehabilitation is something that we do here at Twin Oaks Home Care, but we are not physical therapists or occupational therapists. The physical therapist, occupational therapist, and speech therapist would see the patient first. They would then develop what's called an HEP. That is a home exercise program. Once that is in place, it's a list of exercises with how often they're to be done and how many times repetition they're to be done. Once that HEP is in place, then we can go ahead and follow up with those exercises. Number 26, health and emergency procedures. Again, this is all dealing with safety in a patient's homes. That's our number one goal. We focus on fall prevention. We want to make sure that the patient stays off of the floor. You want to make sure that the lights are on whenever they're up walking. You want to make sure they have appropriate shoes on or footwear on, slippers that have a rubber bottom on them so that gives them a little bit of traction so they're not going to slide. You want to make sure there's nothing laying on the floor where you're going to be ambulating them to where they could trip and fall over that. And you always want to walk either beside them or behind them when they're walking to make sure that if they do start to lose their balance, you're there to help steady them and keep their balance. What if the patient is going to the floor? Well, that's okay. There are times when that does happen. You ease them to the floor. Just remember, our policy is that you're not permitted to pick a patient up off of the floor once they're on the floor. 911 is to be called in that situation. That way there's two of them to come and get that patient up, not you getting yourself hurt or hurting the patient. If that ever occurs, there is a fine that is in place right now. It's $200 for each incident when that would occur, if an employee would pick a patient up off the floor. B is fire prevention. There are fires that happen. We've had several patients that have had a fire happen in their home. We do the best we can to make sure that we prevent those things from happening as much as possible. If you're in a home, you smell something burning, act on it. Make the phone call, get someone there to check it out. Make sure that the outlets don't have a ton of things extra plugged into them. If there's one outlet, then with 2 receptacles there should only be a maximum of 2 things plugged into it. Make sure that the wires in the houses are not frayed and that there's no bare wires showing on anything. We do check to see if there are smoke detectors or fire extinguishers in patients' homes on a regular basis. And if there is anything that you notice in a patient's home that you feel is a fire risk, that should be reported to the office. C, electrical shock prevention. Again, make sure there's no frayed wires or exposed wires in the patient's homes. That's to be reported to the office immediately. A lot of this is just common sense. That's things that you already use in your own home. Letter D, patient on the floor. If you're in the home and the patient's on the floor, they either fell before you arrived or while you were there, you're to call 911. The ambulance will assist in getting the patient up off the floor, and then they will check the patient out and make sure they don't have any further injuries. Make sure they didn't hit their head, make sure there's no neurological changes that would occur. Weakness in one side of the body, slurred speech, maybe a difference in the pupils. One might be larger than the other. That's a sign that there may have been some type of a head injury. If the patient needs to go to the emergency room, they will transport the patient to the emergency room if they're having any pain. If they want to get something x-rayed to make sure that nothing's broken, those are important. You want to make sure that you report all falls to the office as well. Letter E, dialing 911. If they're in a patient's home and there is an emergency, first you call 911. Get the patient what they need ASAP, and if necessary, start the CPR, of which you have received training on. If you haven't received training on, you will be scheduled for the CPR class here at the Twin Oaks office. Once things have calmed down, go ahead and then call the office to let us know that you had to call 911. If the patient is a hospice patient, we don't want to call 911 right away. We want to call hospice. They will determine whether or not 911 is necessary. Letter F, patients unable to assist with transfers. What we don't do here is we don't do deadlift transfers. That means if the patient is unable to assist us in a transfer, we will use other things to get them from point A to point B, from the bed to the wheelchair, from the wheelchair to a recliner chair. We'll either use a sliding board or we'll use a Hoyer lift, or if there's a family member there, there's times whenever it may take two people to get someone in and out of bed or in and out of a wheelchair. And that's fine. Make sure you check the patient's plan of care in the home. We will also give you a little bit of a report before you go into a home. We will also put you in a home with another employee who's been there. That way they can show you the ropes. They can show you where the supplies are located. They can show you where their routine, what time they normally get out of bed, whether or not they have to have blood sugar testing, blood pressure checks, the types of food that they like to eat. If the patient or family refuse to get an assistive device, then what happens is we decide that the patient will stay in bed. If they want us to provide care, it has to be safe. It has to be safe for the patient. It also has to be safe for the employee. If they're in bed, we'll turn them every even hour. We'll elevate the head of the bed during meals like we discussed, and we'll assist them with the use of a bedpan or diapers. If this is a new situation where the patient was able to help before, maybe they went in the hospital, they came back out, you're back in there, and they can't assist you today, the transfers are very difficult. You need to notify the office of that, because we may need to update the plan of care in the patient's home, or we may need to get a new piece of medical equipment in the home. The office will notify the registered nurse that's on call once you call us and tell us there's a problem, and the nurse will then discuss the options with the family in getting the appropriate assistive device in there. Number 27 on the next page, page 12, is our video library. We do have about 100 videos or so here, probably more. And you can sign those in and out at any time. Anytime you're employed here with us, if there's something you'd like to learn more about. Part of our home health aide certification class is signing in and out videos as well. The videos, we ask that you only take one or two at a time, and we ask that you return those within 7 days. And there's a sign in and out sheet. When you sign it, when you take it out, and then when you bring it back in, you sign it. That way we know that it's here, and we can keep track of those. You are responsible for the videos that are in your possession. Any video that's not returned to our office is $100 to replace that, and the employee would be responsible for that. Number 28, patient and family responsibilities. Attached number 18, you have that. Just as we are responsible for providing quality care and services to our patients and families, they're responsible for also providing us with the following, and there's 7 things identified there. 1, complete and accurate information. 2, they have to be involved in everything that goes on in their home. 3, they have to provide a safe environment for our employees when they're in there. 4, they have to notify our office if they're not going to be available for a scheduled visit. I don't want the girls showing up at someone's home and no one being there. Number 5, they have to provide necessary medical equipment and supplies. Number 6, they have to provide the necessary groceries and cleaning supplies. And if you're ever in a home and there's not the appropriate medical supplies or groceries or cleaning supplies, that should be reported to the office immediately. Number 7, and last, is they are to notify our office of any concerns or dissatisfaction that they are having with any of the services that they're receiving. A lot of times there are some personality conflicts, or there are employees that may be arriving late. There are employees that are not, checking things that they did on their daily flow sheet, and they're really not doing them. The families pick up on those things, and they call us and they report them. And they have the right to say, I don't want that person back in my home. And if that happens, that's going to affect your hours that you're allowed to work per week. And those are interventions and steps that we have to take. We have to abide by the family's wishes as well if there's a problem. Number 29, we do have a disciplinary process here at Twin Oaks Home Care. There are several policies that are in place, policies that you've already reviewed and you've already signed off on. They are progressive in nature, the disciplinary process. If someone doesn't follow a policy, the first time that we talk to the employee about it, it's a verbal warning. The second time, it's a written warning. The third time, it's 1 to 3 days off without pay. And lastly, it is termination. If the employee after the third time doesn't change and correct what needs to be corrected, whichever policy infringement it is, then we have the right to terminate that employment. There are some policies that are in place that are immediate termination. If someone is committing some type of fraud or abuse, if someone doesn't show up for an assigned shift and doesn't even call us and tell us that they're calling off, if they're signing in and out accurate times, if they were to take a visitor to a patient's house. Now, those are immediate termination policies. And you need to refer to your employee policy handout if you have any questions about those. Or you can call the office if you have any questions about any policies. We used to have a total pay card number 30. We no longer have that. That's not offered. All employees are required to have direct deposit for their paychecks. If you do not have direct deposit, you can pick your paycheck up here at the Hopwood office on the day that the pay is due. Number 31, the Twin Oaks property form. You see attached number 20. This is so that we get our property back if employment was ever terminated, either by the employee or by Twin Oaks. Even if an employee were to give their 2-week notice, they still have to return the property of Twin Oaks Home Care back here to the office, which includes name badge, any videos that they may have out, any patient information sheets that they have out. What happens is we will hold an employee's last paycheck until that property is returned. Once the property is returned, then we will go ahead and release that paycheck. So it's really important that at any point in time, if your employment is no longer here at Twin Oaks Home Care, that you do make an effort to get that those belongings back into the office as soon as possible. The next 4 things here, number 32 is 21 reasons that home care pays. Basically talks about the importance of home care and the quality of home care compared to being in a nursing home or in a facility. There is less chances of infection. in a patient's home. There are less signs of depression. Patients actually do better in their own home. Those are a few, just to mention a few. Number 33, Twin Oaks Home Care's goal statement. See attached number 22, our goal statement. Let's find that here on this other page because it's really important. We are to provide excellent, consistent, quality, and affordable care regardless of patient differences. It doesn't matter what color a patient's skin is, what their economic status is. We provide the same quality care to each client. Number 2, to ensure that the patient receives 2 employees 80% of the time that we are scheduled in their home. Patients and families a lot of times will say, I met this one girl for the first time, that's the only one I want. I want her 7 days a week, I want her 16 hours a day. And that's just unrealistic, and we do tell patients and families that. Our goal is the same 2 employees 80% of the time. That provides a consistency that the patients can be comfortable with. That also provides a consistency where the employees are comfortable going into the same home. They already know the routine, so we do try to keep the employees in the same homes. Number 3, to eliminate overtime because employees have a life outside of the work. We don't like to schedule overtime. There are times when we have to deal with call-offs. We have to deal with maybe a new client that we're picking up and we're trying to cover some shifts. We do pay overtime for anything that's worked over 40 hours a week, but we try not to schedule that ahead of time going into a schedule. Number 4 on our goal statement, to provide the highest level of education to each employee through in-services, videos, hands-on experiences, and appropriate resources 24 hours a day, 7 days a week. Anytime that an employee is at a patient's home, there's a problem, there's a question, there's an issue, they can pick up the phone, they can speak directly to someone here at the office. If they're not able to answer your question, then they know who to get a hold of to get your question or concern addressed. Number 5, to never lose compassion. What we do does take compassion. It takes people who care about what they do. They want to see the patients do well. And we have to strive not to lose that compassion that we provide for patients and families. Number 6, to always provide appropriate and safe care for the patient and family with their best interest in mind. Our safe care is number 1. And that's who we are, that's what we do. And number 7, to remain committed to the other people that we work with. And there are several things listed there. Accept the responsibility of establishing and maintaining a healthy relationship with each other. Talk to one another promptly if there's a problem. We're not here to tear other people down, we're here to build them up. To trust other people that we work with, the other members of the staff. D, to show equal respect regardless of titles or education levels. E, to not bicker, backbite, or blame. We don't want to bicker, backbite, and blame. We want to be able to solve problems and move forward. F, to not complain, but to work together in achieving every goal. G, to accept everyone as they are today, regardless of any past problems that they may have had. H, to be committed to finding solutions to problems. And I, to remember that no one is perfect, and if an error does occur, it's an opportunity for growth and forgiveness. That's our goal statement. We've had that since we started in September of 2000. 34 is the management structure. The management structure is it's divided into 2 separate areas. There's the office structure and there's the client home structure. If there's an issue dealing with anything that has to pertain with the office, my wife Dawn is the owner and the CEO. She is the top manager here in the office. Then would be an office manager if there was an office manager in place. And then the office secretaries. Then the after hours on-call supervisor. Anytime the office is closed and you call in, you would speak directly to one of them. And then in the client's home, if there's an issue, a concern, or a problem, that would come straight to me. I'm the corporate secretary. And after myself, there would be the office manager would fall into place if there was an office manager. And then the staff nurses that are out in the field, the home health aide supervisors, and then the home health aides. And last on orientation agenda, we have number 35. It talks about the Home Care University, and that is the certification for home health aides that we do here. Within an employee's first year, they are required to become home health aide certified, and that's for our workers' compensation insurance purposes. It is a 75-hour class. We do teach that here at the offices. We teach classes both here in Hopwood and in Waynesburg offices. Depending upon where you live, that's where you'll be scheduled. It's 1 day a week for 10 weeks, and then there is a 50-question test at the end, which I will give employees a study packet to study for the test as well. And then at the end here on page 12 of the employee handout for orientation, there are 9 videos that are listed here. These are some of the videos that you can sign in and out, and these are some of the videos that employees will watch during orientation. Thank you. I'm really glad that this orientation DVD is over, all 6 of them. And just so you know, if there's ever a problem or a question, don't hesitate to call into the office and speak to one of us here. We've always been eager and willing to help. Thank you for your time.